I have not been in home infusion for very long at all, but I have been a pharmacist for a long time. And my background is hospitals and healthcare systems. And in those types of areas, you have a lot more financial backing when it comes to leveraging technology. The EHRs that you have access to, the pump technology, and the things that I'm historically used to working with. When I went into home infusion, I realized, that's not necessarily the case here, right? I kind of joke around saying home infusion tends to be very lean and mean. So when we had the opportunity to open up our facility, what I tried to do with the staff that we hired was really try to understand, right, because I was learning what home infusion was try to understand where their gaps where were their challenges in their experiences working in a home infusion facility, right? And the things that I tended to hear was challenges around pumps, challenges around specifically milrinone patients. And then once we actually opened, we realized that, hey, there's actually a lot of pharmacies who are refusing to take these patients, right? So even pharmacies that are so willing to take every other order, for some reason would deny these patients, so they kept coming to us. So what we have here is actually a very happy slide. It happens to be a milrinone patient. So right now we are almost exclusively using our Connect devices on inotrope patients. We've used them for a couple of DPNs and antibiotics when we first got started, just to have a better grasp of the technology and understand how it worked. But really what we wanted to show here, and this slide is directly from the actual Insights platform, is the type of documentation that you get when you see what a patient is actually getting or theoretically, not getting. So with our inotrope patients, we do dispense 2 pumps, and that means 2 Connect devices, and they do rotate them, and you do have the opportunity to see just how they're actually administering, how it's usually 97 or 98% compliance with each bag. And obviously if they're late on the actual administration, you would see that as well. So some of the pain points that we really tried to address with the staff was our on-call pharmacists and the issues that they had around getting calls around pump alarms and not necessarily knowing how to address them, right? The patient confusion, they might try to read what's on there, but really it's beeping, and how you try to address that and getting nursing involved. So with the Connect, we've really been able to identify the actual alarms and the reason the alarms are happening, which just allows us to triage the situation a lot better, right? Sometimes, yeah, absolutely, you need to send somebody out, but most of the time it's something that you can work through because you have direct insight into the actual technology and you can see exactly what's happening. So it just gives you a lot more access and information.